I want to thank off the top Bonafide Health. Bonafide was a gold sponsor of the very first Hot Flash Inc. Summit, managed to bring together 36 amazing speakers, not a fear mongering person in the bunch. And we helped over 3,000 women sort out what's going on with their perimenopause and menopause health. We went way beyond hot flashes and sleep problems. We got into trauma and so much more. And I'm so proud that they were able to help me do that. Bonafide provides novel, safe, effective, and research backed solutions for women's health, from hot flashes and vaginal dryness to mood and skin changes. Bonafide is working to set a new standard for menopause care by bringing their trusted, evidence-backed options to the retail aisle nationwide in the US at Target. Bonafide is providing millions of women with more access to science-backed solutions. To learn more, visit hellobonafide.com and be sure to use code SUMMIT20 to receive 20% off the first month of any Bonafide subscription product. Thanks again, Bonafide. I really appreciate it. I'm Anne-Marie McQueen, journalist and proud 50-ish woman, and we are here looking for the true truth in perimenopause, menopause, midlife, and beyond.
Opening our minds to other possibilities is not always easy.
Hot Flash Inc.
You're all woman to me. All right, Anne-Marie.
And if you're bummed that you missed the summit and it was really good, and you did, it's not too late to get an all-access pass. That's $47. You get the Hot Flash Inc. Summit Book of Knowledge, all the takeaways. You get great tips. Talk to all these women from deep, deep expertise and so much hope. You also get the beta version of my hormone therapy navigator. The link is in the show notes, summit.hotflashinc.com. You can get it for yourself and have it forever. Well, I don't know whether you heard, but they removed the black box warning from vaginal and topical estrogen this week. Yeah, it's true. It's literally everywhere. My friend texted me. She's on hormone therapy. It helped her sleep. She's struggling a bit with vagina stuff. She texted me like, this is everywhere. The U.S. Food and Drug Administration followed up on hearings that they held last summer, and they removed this black box warning. It was placed on hormone therapy after the Women's Health Initiative study. Little bit different scenario from most black box warnings, which are placed after a drug hits the general population and many people start taking it and problems crop up. That was the case with Veosa, also called Fazolintand, which is the non-hormonal drug for hot flashes and vasomotor symptoms. And there turned up to be some cases of severe liver damage. So there's a black box warning on that drug. And I had a doctor once say to me, she doesn't prescribe any drugs until they've been out for 5 years, because that's how you know that they're safe. Isn't that crazy? Anyway, it seems that the FDA and everyone they invited to speak has concluded what the scientific evidence has not. And we have some big voices speaking out about this, but no one really wants to hear it because people want this to be true. They're making it true. Like I'm reading from the HHS website, quote, studies have provided evidence that starting HRT within 10 years of the onset of menopause can have numerous benefits, which for most women outweigh potential risks. It is true that for most women, the benefits outweigh any potential risks. But it says, quote, the benefits include reduced risk of all-cause mortality and fractures. Yes, that's true. HRT has also been associated with a 50% reduction in heart attack risk, 64% reduction in cognitive decline, and 35% lower risk of Alzheimer's. I encourage you to read my Substack this weekend because I'm going to tackle something that is so confusing, but I think I figured out how to explain it. These are relative risk numbers. That does not mean when you're sitting there and you hear 50% reduction in heart attack risk that your personal risk reduction is cut in half. It doesn't mean anything close to that. It's actually very minuscule when you use absolute risk reduction, which is, I'm not going to get into it now. I need you to read my Substack on Saturday. You can sign up for that at hotflashinc.substack.com. Those are findings from observational studies, and there are also studies that show that it can increase heart attack risk, that it can increase cognitive decline, and we're going to hear more about this in this podcast. They do quote an analysis of 30 trials with more than 25,000 women that found hormone therapy was not associated with increased cancer mortality. This is all about how estrogen doesn't cause cancer. You can hear the people that I quote and the sources that I go on to find. This is something you've got to decide for yourself. The risk could be very low, but it feels like now they want you to think there's absolutely nothing. So the FDA is not seeking to remove the box warning for endometrial cancer for systemic estrogen alone products. They're working with companies to update language. The starting time of HRT and duration are decisions best made between the prescriber and the individual patient, but their labeled recommendation will be to start HRT within 10 years of menopause onset or before 60 years of age for systemic HRT. That's important. They're still keeping with what the guidelines say in this regard. They say they analyze the current relevant literature, including a reanalysis of data from younger cohorts of patients who initiated HRT within 10 years of the onset of menopause. I interviewed a couple of doctors the day after the news broke, so I asked them about it. Dr. Kirsten Smith is a naturopathic doctor practicing in Canada and Costa Rica, and here's what she had to say.
It's becoming kind of out of control, and I don't really know how it's going to be in a few years. I think, and the FDA thing yesterday in terms of them removing black box warnings, which means on the pamphlet that comes inside the estrogen products. So I had expected that it was going to be solely vaginal estrogen, and removing those warnings that it could cause heart disease would have been appropriate because it just would be appropriate for the science. But this was extended to topical estrogen products, and it's not entirely without risk. It's very low, but it's not entirely without risk. So again, that was interesting that the FDA did that. And so it's a big deal and it's fundamentally positive, but it's, again, it can create a message that it's without risk, and it's not.
And I also spoke with Dr. Rachel Pope. Her interview will be coming up just like Dr. Smith's in the coming weeks. But Dr. Pope is an obstetrician gynecologist in the Department of Urology with an appointment in the Department of Reproductive Biology at University Hospitals Cleveland Medical Center. We're going to talk to her about her grossly misrepresented study that looked at hormone therapy safety in perimenopause. But here is what she had to say about the FDA's decision.
If you want to talk about like the FDA changes to the black box label, I am thrilled. I'm thrilled that they're taking it off of the vaginal estrogen prescription in the US because that never should have been there, right? We don't see vaginal estrogen associated with any of those cancers. We don't see it associated with heart attack, stroke, or blood clots. And so it never should have been in there. But I don't know that we have enough data to say that there's no link to estrogen. I do think that it's the physicians and the health and the advanced practice providers who should be having those conversations. But, I think about my patients like I think about my family. And my sister has a estrogen responsive uterine cancer. And I would never want her to think that she should have started estrogen and it would have reduced her chances of having that cancer, right? If she had started systemic estrogen in perimenopause, it would have much worsened that cancer. And yes, what she has is rare. It is a rare aggressive form, but it would have really made her situation much more dire. And I'm grateful that she's with us today, still battling the effects of it. But, that would have been the wrong message for her. And so I want to make sure that we're still being responsible to women and we're still giving them all the information we have and not, again, overstating what we don't know.
I just want to point out that she said systemic estrogen there. The audio did a weird jiggy and it cut out systemic, but then she clearly went on to talk about systemic estrogen. So Marty Makary is the commissioner of the FDA, the U.S. Food and Drug Administration, and he was all over the airwaves talking about this decision. He's got lots of things to say. He's got a very slick message here. He is on NPR, and I'm just going to do this the old-fashioned way and play this quote from National Public Radio in the US.
There's been this increasing recognition of the health challenges, the very real challenges that women face during menopause. And you and I were talking about the nuance in this conversation earlier. Do you worry at all that by removing this black box warning that it might result in the pendulum tipping the other way and there's now going to be an overuse of hormone therapy?
Well, tragically, over the last 23 years, 50 million women have been denied or talked out of hormone replacement therapy, in part because of the fear machine that replacement therapy is a carcinogen. It causes breast cancer. We can argue whether or not the old type of progesterone used, called MPA, in that original study may have slightly increased the risk of breast cancer in women who took that MPA. But no clinical trial has ever found that it increases the risk of breast cancer mortality. And if it did, that harm would be far eclipsed by the profound cardiovascular benefits. Early on in the 1920s, Mayo Clinic researchers noted that young girls who had their ovaries removed went on to have heart disease in their 30s and 40s, suggesting a profound cardiovascular protective effect. And so that's the nuanced conversation that people need to have.
Okay. Okay, Marty. Kind of weird that you referenced a 1920 study from young girls who had their ovaries removed and developed cardiovascular disease in their 30s and 40s to illustrate the profound protective benefits of hormone therapy. Did you not have anything more conclusive or more current? I mean, this is the kind of thing people just keep saying over and over, that it's so protective for menopausal women. But then you go and quote a study from the 1920s in girls. Like, we know that you can't lose all your hormones early and all at once. The outcomes are not good. You develop those diseases. And this is again an example of someone who really should know better. But I feel like this whole conversation is co-opted. You're mixing apples and oranges. A person going through menopause around the average time is not the same as someone who goes through a surgical or a sudden menopause for some other reason. And it's well documented and outlined in the guiding body's advice that if you have an early menopause, you are to do hormone therapy until around the average age of menopause. We were designed to go through this. So again, it's not that I'm not saying it doesn't have heart protective benefits. I've interviewed so many people who said that. But the little widget part of it that just is so irritating is that, why are you comparing young girls who lost their ovaries to women who are naturally supposed to go through menopause? It's enough that hormone therapy helps women with their symptoms. And if there's a protective benefit of sorts, then great. But when we see these observational studies, there's mixed research. Sometimes it can cause cardiovascular disease. That's why we have the Women's Cardiology Committee in 2023 saying we don't recommend it to prevent cardiac problems. It's just very weird to me. And also, did you notice that he might be the most senior official that has acknowledged that there was a problem with the medroxyprogesterone, that any of the risk of breast cancer in the Women's Health Initiative might have come from the synthetic progesterone, the progestin. That's something that has been seen in the research, and smart people are increasingly talking about. McCarry's throwing out a red herring, like, we can argue all day about this because estrogen isn't any problem at all, right? Like, in this, estrogen is safe, and that's the mission of this statement. But I think it's interesting that he threw out a red herring that kind of backfired, if you know what you're talking about, because now you have someone acknowledging that there might be a problem, even a slight problem, with medroxyprogesterone, progestin, which is in the birth control pill, which is in the IUD, and which many women take. It's in the combination patch in different, these are all in different levels. So I do think that's, I think that's really interesting. I just think that's some real smooth messaging going on there. It makes me just want to say, what about the millions of women that are on these progestins that no one will ever acknowledge there's any problem with? Like, millions of people who have been on the pill, and some people feel they could change them forever. You're discredited and called dangerous, and you have the highest man in the land saying there might be a problem. And, this comes at a time when mainstream medicine really interchangeably prescribes progestins and progesterone. And the progestins, which are synthetic, they don't have the same chemical structure as progesterone, bioidentical, whatever you want to call it. that is also made in a lab, but it's made from plants, yams or soybeans, and has much more similar structure, more benefits, and the synthetic progestin acts differently in the tissues. We could argue about that all day long. He doesn't acknowledge that, but he acknowledges that it's an issue. So I feel like, we had on my Substack on Tuesday, I had Dr. Alyssa Dweck, who is an OBGYN veteran. She's chief medical officer for Bonafide. Dr. Dweck was doing takeaways from the Menopause Society annual meeting for 2025, and she said they're just starting to talk about progesterone. Anyway, that's that. You know the feeling when you tried all your health trends, but you're still tired, foggy, or just not yourself? It's not your fault. True health starts deeper at the cellular level. Enter the first ever longevity gummies powered by MitoPure. They're the only clinically proven urothalin A gummies designed to recharge your cells, boost energy, and help you feel strong and vibrant from the inside out. They taste great. I've tried them. They're vegan and clean. And MitoPure's own testing shows they can add up to 12% more muscle strength in just 16 weeks. It's like giving your body a daily cellular tune-up. If you want to feel energized now and as you age, click the link to timeline.com in the show notes and use my code HOTFLASH for 20% off your first order. That's timeline.com and code HOTFLASH for 20% off your first order. In the breathless enthusiasm, I always like to sort of come in and say, hey, not everyone's so enthusiastic. And one of the takes that I saw that was really good was Kira Butler and Julianne McShane writing in Mother Jones. And the title of the article was The Many Problems with the FDA's Big Menopause Announcement. And I really want you to read this article because they go through point by point of the huge enthusiasm and what everyone from the menopause was saying, and then what other doctors felt. I really like this quote from Adrienne Sandra Dobbs, one of the experts they interviewed for the article. She's a professor in medicine and oncology at the Johns Hopkins University School of Medicine's Division of Endocrinology, Diabetes, and Metabolism. Dr. Dobbs cautions against relying on influencers for selling supplements or claiming that HRT will solve all women's health problems. Unfortunately, she says, nothing really keeps us young except things like stopping smoking, exercising, and lifestyle modification. She goes on to say there's a lot of hype to hormones. We think they're going to cure everything, and they really don't. Another really, really good piece was written by Jennifer Block. She is a long-term health writer. She was an editor for Our Bodies, Ourselves, and she was writing in the Free Press. The piece is called Estrogen is Back. He quotes Dr. Marty McCary, and I have to say, the way this guy talks about hormone therapy and the way Peter Attia talks about hormone therapy, it's so hyperbolic. I'm not diminishing. And one of the real tragedies of the Women's Health Initiative study was that women who went through the hysterectomies couldn't get hormone therapy. And if you go into a surgery like a full hysterectomy and you come out without your hormones, you go in with your hormones, you come out with them, that's god awful to deal with. And that's a crime. And people did die. They've actually studied that. Dr. Phil Sorrell at Yale University has studied that and estimated that 100,000 women may have died because the outcomes when you lose your hormones suddenly and early all at once, they're not as good as, we were meant to go through menopause. You don't probably really get that message today from the discourse, but we were designed to go through it. We did adapt to go through this. There are certainly accommodations and adaptations that happen in our body. But if you have a hysterectomy, it's a different story. Jennifer also found someone that I'm dying to get on the podcast, Adrienne Fugue Berman, I hope I'm saying that correctly, a professor of pharmacology and physiology at Georgetown University, who is an expert on how pharmaceutical industry influence affects the practice of medicine. She runs a watchdog group focused on this issue called Farmed Out. And she says that those pushing widespread and lengthy estrogen use do not have the evidence on their side. Quote, there's nothing new that has come out since the WHI on either improving new symptoms or new proven health benefits. Lately, there's been this major attack on the Women's Health Initiative. She says the criticisms were ginned up by pharma companies. As an expert witness in litigation, she's seen thousands of internal company documents, among them evidence of widespread ghostwriting of medical articles promoting HRT. In one paper, she and colleagues traced dozens of articles authored by physicians who were paid by hormone manufacturers that repeated identical claims about the WHI, that it was flawed and controversial, that the women studied were too old or too sick to have benefited from hormone therapy. She wrote in a journal commentary. Pharma trashed the WHI. She is part of the group that banded together to criticize the M Factor documentary that Tamsin Fadal is a producer of. She's been a guest on the podcast. They petitioned against accounting towards continuing medical education credit for physicians. They said that that documentary contained nonstop dangerous disinformation. I covered that in the Tamsin interview, and I have a postscript for what Tamsin came back to say about that. It's quite shocking when you read what Adrienne Feuberman says. I mean, it is a completely different story about hormone therapy. And I think it's very important that we listen to these people rather than just listening to one side. That's all good news all the time. She believes that hormone therapy can be very helpful for symptoms. She begged a friend to go on it. But listen to this. She said to hang every facet of aging on menopause and present hormone therapy as the cure-all is ridiculous. And this is her quote. We have proof that estrogen and progestin increase the risk of dementia and mild cognitive impairment. End quote, along with stroke, blood clots, and gallbladder disease. As for breast cancer, quote, rates dropped substantially, end quote, around the world after women stopped taking hormone replacement in the wake of the WHI findings. She called the HHS press conference to announce the removal of the black box warning an embarrassment. She says they presented opinion as fact and they misrepresented epidemiological evidence. For her, it cements the demise of the FDA as a source of evidence-based medical information. She says women should use the lowest effective dose for the least amount of time. It's fine to take menopause hormone therapy for symptoms, but no one should take it for disease prevention, no matter what the FDA says. We know how many people don't believe that, but we also know that every guiding body in the world does not recommend hormone therapy for the prevention of disease. And I think what happens a lot is, from my discussions with doctors who are cautious about this and who are nuanced, is that I think people really simplify, like, oh, estrogen does all these great things before menopause. And so if it leaves, it must be bad. And I just believe that what we're leaving out of the conversation is all of this beautiful adaptation, that this unbelievable machine that we have, that no one's ever going to design anything as unbelievable as the human body. There's so many adaptations that I just think that that's a really simplistic view. And as someone told me recently, the most famous people in the menopause conversation are in private practice. And they use their social media following to drive their private practice. In turn, they earn a lot more than doctors who are researching and working in the insurance-based system. So they have a team to help them with their social media, and it's like a loop. And it's really frustrating for really good doctors and really smart people who just don't have the resources to do that. So I'm really excited. I'm happy. I think vaginal estrogen should be available probably without a prescription. But I also think, look, there's DHEA for your vagina. I'm interested in testosterone for your vagina. We've talked about that with Brooke Fott, who's a nurse practitioner, and you can go back and listen to her podcast. She's using estrogen and testosterone together. And there are testosterone receptors in your vagina too, but we don't hear about that, right? So I think that's all very interesting. I made a TikTok today. Let's see if I can remember what I said. I said, I want you to know three things. I want you to know what kind of hormone therapy you're on. Are you on one of the older synthetic forms of estrogen, oral estrogen? Are you on bioidentical hormone therapy? And I'm making like quotes, air quotes with my hands, because there's a lot of confusion over that term too. But are you on a form that's most like what your body makes, that is made from plants? It's still synthetic. Do you know if you're on progestin or progesterone? Because progesterone is made from plants. It's most like what our body makes chemically, structurally. And progestin is a little bit different and it acts differently in the tissues. And I think that's something that you should know. Someone just asked me on TikTok, is the Marina coil bioidentical progesterone? No, it's not. It's progestin. And I think that's something you should know if you're putting it in your body. Number two, I think that you should probably make a plan or have an idea of what you're trying to accomplish. Because as a friend I was talking about today, she said, I'm always forgetting to take it and I always have to get it. So, are you going to do this for life? Are you going to have a prescription for life? You're going to be running around when you're going on vacation and make sure you have your hormones. She was saying that she couldn't get her estrogen and she had to go away and she couldn't sleep. Are you going to go off it later? Are you going to consider the fact that you might have a resurgence of symptoms? I think those are two very important questions. And do you know the risks and side effects? Because there are risks and there are side effects, and some women don't do well on hormones at all. And do you have a plan? Dr. Vikram Talalakar, who has been a guest on this podcast, told me that you really need to give it 4 months when you give it a try because your body has to get used to it. And he gave a whole bunch of other reasons. And I encourage you to go back and listen to that podcast. But I know I tried hormone therapy and I had a really hard time and I didn't have 4 months to give it. I didn't even try estrogen because I had such a hard time when I tried a form of birth control that had estrogen. But I did take maca, which obviously boosted my estrogen, and I didn't sleep for 3 days. And when I took progesterone, I was moody and bloated. And there's some people who are saying you weren't taking enough if you took more. I just know that I couldn't live like that. So I think those are 3 questions that you might want to ask that I've figured out from talking to all these people over these years that are important. And I want to move on to someone I interviewed who passed away. His name is Dr. Burt Webb. He is still my favorite podcast guest. I interviewed him way long time ago. And he's one of the rare people that I had a press release sent to me, and I just thought he'd be interesting to talk to. The press release was he had signed up with, it was like some sort of machine that helped your vagina with genital syndrome of menopause symptoms. But I just thought, yeah, he sounds cool. And little did I know, like, I love those little hunches because normally when people are pitched to me, I'm like, oh, they're just trying to get notoriety. But he was pitched by the company that he had signed up for to promote this machine, which he really believed in. But he's an OBGYN practicing out of Arizona, a long time, just the coolest man. I made 2 episodes out of it. So he was going through a cancer treatment. His camera wasn't on. I later saw what a handsome guy he was. And he was recovering from cancer. And then I saw him on social media and he was clearly, doing a whole social media push. And I thought, this is great. This is exactly the kind of person we need on social media. He listened to women so much. He had so many smart things to say. He's the one who told me, the first person to say, Emery, most of the vagina problems that I see have to do with the microbiome in the gut. And when I clear up gut problems, I think he said something like half of the vagina problems go away. He talked all about hormone therapy. He was a big fan. And the reason I'm thinking of him is because his wife, Terry, this week, when the black box warning was lifted, posted that it was the day that he passed away. And so that he was somehow involved in this miraculous announcement. But it just made me think of Dr. Webb because I think about him often. I have a soft spot for him too, because I had just launched my paid subscription to my Substack and he signed up. And he said, I love what you're doing and I want to support you in any way. And when you're just starting out and someone goes out of their way to say that, it really means a lot. I really want you to go back and listen to those episodes. They're episodes 83 and 84, and they're, I think, called Vagina Stuff with Dr. Burt Webb. One of the other things I took away, he was telling me this story. First of all, a great tip about how the applicator for vaginal estrogen just goes up inside. And not very many people talk about you should rub the estrogen in to the vulva. And he was the one who said you got to get it all in the folds. And he said he was actually on a flight with his wife and he wasn't sitting with his wife for some reason. And somehow he ended up in a conversation with the woman beside him and he started giving her this tip and he was waving his finger around and telling her you really got to rub it in. And his wife was giving him the stank eye because maybe she didn't like him talking to this woman, or she just wondered why he was waving his finger around. I loved that story. And I loved that he did the interview with me when he was going through chemo and he was in the hospital. I just loved his spirit. And I am so happy to have connected with him for an hour of time. And I just feel like he is a special person. I've met a lot of special people since I launched this platform, and he is definitely one of them. He was one of the good ones. And I think anyone who's his patient was very, very lucky. I think there's a lot of room for men in this conversation. And if you're confused, go back and listen to it. The sound's probably terrible because it was early on in my podcast. That is it for now. As usual, I am your person who you can be relied on for nuance and to say, hey, 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 hey. There's some other sides to the story here. And I have some really great interviews coming up with some really great doctors. And I hope that you keep listening. And I want to invite you to like and share this podcast. Have a great week.
Hot Flash Inc. was created and is hosted by Anne-Marie McQueen, produced and edited by Sonia Mack. The information contained in this podcast is intended for informational purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, read all labels, and heed all directions and cautions that accompany the products. Information received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem, i.e. menopause or anything else, or any healthcare questions, please promptly see your healthcare provider. This podcast, including Anne-Marie McQueen and any producers or editors, disclaim any responsibility from any possible adverse effects from the use of any information contained herein. Opinions of guests on this podcast are their own, and the podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about a guest's qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. This podcast is owned by Hot Flash Inc. Media.